Afternoon everyone, and welcome to the fortnightly update from Warwickshire Public Health and Early Years. For those of you who don't know me, I'm Jane Coates and I'm the COVID testing lead for Warwickshire and part of the public health team. I'm hopefully being joined by my colleague Fidelia Richardson from the public health duty team today. Many of you will know Fidelia from having been in touch with her previously around outbreak management processes and other situations in your settings. Between us, we hope we'll be able to answer your questions today, and anything we can't pick up immediately, we'll come back to you on via Sonia and Jessica in the Early Years Advisors team. I do want to give you an early warning that I'm experiencing issues with Microsoft Teams today, so this could be interesting. In an earlier broadcast from this morning, we found that the chat column wouldn't work at all, so we weren't able to view questions coming in and post links, etc. So please do bear with us if we've got technical issues today, and be assured that you can still submit your questions to early years colleagues and we'll get an answer out to you as quickly as we can. So to fully tempt fate, if you look in the chat column, hopefully you'll see that I've pasted in 2 bar charts showing the latest data on case rates in Warwickshire. If you double click on each one, it will grow so you can see it in full size. The grey bar chart shows the most recent 7-day rolling rates per 100k of population in Warwickshire, and it compares it to other parts of the West Midlands for context. So as a whole county, we're sitting at around 320 cases per 100k of population. And overall, the pattern is one of peaks and troughs. It's very up and down, very unsettled at the minute. You'll be able to see that North Warwickshire has the highest case rates currently at almost 371 per 100k of population, followed by Nuneaton and Bedworth, Rugby, Warwick, and then Stratford at the bottom at around 300 cases per 100k of population. To paint the picture, we're ranking in the upper half of local authorities in the West Mids just now. The pink bar chart reinforces the pattern of peaks and troughs that I've mentioned, but does appear to describe an overall slow rise in case numbers across the county. To give you a sense of that, we currently have around 1,800 positives in county just now. I think in fairness, this pattern of cases won't come as a surprise to you or indeed anyone else. Government was clear in telling us to expect cases to increase once the 16th of August changes came fully into effect. And what we know from conversations with some of you is that the removal of the requirement for close contacts to self-isolate does appear to have been a trigger for increased numbers of positive cases right across the range of settings. Government talks about this scenario as one of the expected stages of us beginning to live in a post-pandemic world in which COVID-19 continues to exist. So protective measures including ventilation, touch point and hand hygiene remain as recommendations to reduce the spread of the virus, but it's now very much up to each setting to identify what works for them. And I suspect you'll all be considering this and revisiting your plans if and when cases and concerns emerge in your own settings. Education, Early Years and Public Health issued guidance during the summer break to help you contextualise the precautionary measures within the updated government guidance and messaging, and also to help you revise your risk assessments accordingly. I really hope you found this useful. The public health advice, as you would expect, continues to promote positive hygiene practices in settings as a preventative measure against increasing case numbers. We recognise that these measures go above the national guidance, and I want to be clear to you that they are recommendations rather than requirements. The decisions rest with you about the best way to operate to maintain the integrity of your offer. We will, of course, continue to be here to advise you wherever patterns of cases and outbreaks occur. Speaking more broadly, the case rate patterns demonstrate that workplaces and social gatherings remain higher risk in terms of virus transmission. I think this is very predictable, in all honesty, but useful as a cautionary tale for us all. One or two queries have come in from early years colleagues in recent weeks that I think are worth covering here. One is related to whether people who've received both COVID jabs and who test positive with a PCR test need to self-isolate. The answer is definitively yes. Anyone testing positive with a PCR test, regardless of their vaccination status, must follow the long-established government rules to isolate for 10 days or until they are symptom-free if that takes longer. We've also had a number of queries about self-isolation and who is exempt under the revised government guidance. So if you live with someone who has symptoms of COVID-19 or who has tested positive, you will not need to self-isolate if any of the following apply. So if you are fully vaccinated, and to be really specific about this, this means within 14 days have passed since your final dose of a COVID-19 vaccine was given by the NHS. If you are under 18 years and 6 months old, if you're taking part or have taken part in a COVID-19 vaccine trial, or if you're not able to get vaccinated for medical reasons and you've been exempted by a medical professional. If someone you live with has symptoms of COVID-19 or has tested positive for COVID-19, you should still get a PCR test to check if you've got it or not. You should still follow the advice on how to avoid catching and spreading COVID, and it's worth considering limiting contact with people who are at higher risk from COVID-19. The onus is now very much on individuals to take responsibility to limit transmission, and the progress of the pandemic from this point on depends on the level of compliance people are willing to commit. Moving on, I don't feel like I can avoid mention of the vaccination programme, although I'm afraid I don't have a definitive answer for you on what's going on. The national media is issuing some muddled messages about jabs for 12 to 15s and booster jabs and which groups will be prioritised. The honest comment here today is that things are literally changing by the day, and I expect there will continue to be some more confusion before a definitive position is reached. The announcement of jabs in secondary schools came during the summer and led to some action between Public Health Education and Coventry and Warwickshire Partnership Trust as the lead health organisation to consider those practical aspects of standing up a programme predominantly delivered through secondary schools. This is on hold now because the national position has currently changed, but the plans have been put in place and could be stood back up again should that approval be put in place. So the legwork has been done behind the scenes, but we are currently paused, and this is out of our hands for now. In terms of booster jabs, again, there's a fair amount of conflicting information in the public domain about eligibility. Once a definitive position has been agreed, our health partners will be acting really quickly to invite target groups to attend for booster jabs. I'm sorry, but this holding response is the only one I'm able to give you just now. And I recognise that the inconsistent messaging at the national level is not awfully helpful in terms of providing confidence and helping people understand exactly what the position is. I'm going to hand over to Fidelia in a moment to talk about a limited support offer for settings from the health protection team, but I wanted to finish with a reminder to you about the outbreak management guidance and the template information that you received during the summer from the early years advisors team. The document attached to that email contains some really useful pointers and information to help settings, particularly those of you that may have been closed during the summer months, to stay in the swing of how to plan for and deal with cases as they arise, particularly under the new arrangements. So do please check back to that last email from the early years team to read through the guidance, which, as I say, is attached to that email. The team remains on hand throughout the week to advise you, so do please drop them a line. I know they're really keen to help you. It's worth noting that the Education Corona email address and the Public Health Duty Desk facilities also remain in place, so those mechanisms are there to call on as and when you need them. So I'm going to ask Fidelia now to come in and provide any other updates that I might have missed and the update on health protection support. Thanks, Fidelia.
Hi, thanks, Jane. Hi, everyone. So I'm going to be very brief. Just wanted to say quickly that we have been looking at providing nurseries and early year services some support as it pertains to your cleaning and hygiene practices. We have a team of response officers who intend to come out and do some visits if need be. And those schools will be selected based on need basis. Outside of that, if a setting has a certain number of cases and we feel that it would benefit that we do a visit, then we will do that as well. But I just wanted to hear your thoughts on this. We are going to be sending out a survey that will basically ask a few questions related to, how can we help in this regard, and we would definitely appreciate your feedback there because it will help us a lot to determine what our role will be in assisting you going forward. As Jane mentioned, with the absence of bubbles, I mean, I know these settings tended to not have bubbles, but with a lot of the guidance changing, we do understand the importance of amping up in other areas. So like our cleaning and hygiene and so on, we have to now be spot on with these areas. Also something to point out, a lot of schools have been concerned about children coming into the setting when there are positive cases in the household. And that's why also we do stress the importance of good hygiene practices in the setting and good cleaning, because we do know that moving forward, this will be something that we will see. Parents are positive and the child can still come to the setting. National guidance says that face-to-face education is our priority. Therefore, unless that child is displaying symptoms, are experiencing symptoms, because displaying and experiencing might be two different things. Once that child is not displaying any symptoms or has tested positive, then that child can attend the setting. And that is something I know that is very controversial at the moment. So until any changes, we just ask that you try to maintain good cleaning practices, and we will be around to assist you in these regards. So if you have any questions, just reach out to us and we will continue to assist you as much as we possibly can. I think that's about all I had to say today, Jane.
Lovely. I haven't been watching the chat column because I've just gone off to look for the link from the British Fertility Association, Society, I beg your pardon, on vaccines for pregnant people. And I've just put that link in the column. So Melissa, hopefully that will give you some really definitive advice, and you're very welcome to share that link with other people as you find that useful.
I think, Jane, we sent that out with the briefing as well a couple of weeks ago. Thank you.
Perfect. I can't see any other questions in the chat column, which either means it's not working or we've done a very good job of answering your questions today. But I just ask colleagues if anybody does have anything else that they'd like us to pick up today.
If you're having difficulty putting it in the chat, feel free to just jump in or put your hand up if you've got a question for Jane or for Dahlia.
I'm currently feeling like Fidelia and I have done an exceptional job today.
Good for you, Jane. Okay, it doesn't look as though we have got any questions. As always, you can email into early years advisors at warwickshire.gov.uk or to early years, and Jessica always forwards them on. So just a big thank you again, Jane and Fidelia. As always, really useful sessions, and I think generally people appreciate the opportunity to catch up once a fortnight. So many thanks. Well, you've done a great job today. Thank you. There.
We'll see you again
as well
in a couple of weeks. But please just drop us a line if you have any queries. We know it's quite an unsettled period at the moment, and frankly, you receive much of the information at the same time as us. But we're very committed to doing what we can to help you cut through where there are any problems. So it's really nice to see you again, and see you in a couple of weeks.
Thanks, Jane.